July 9. We have our workshop meeting today, but we're opening first with a public hearing in regards to the Human Services Plan for 2020-2021. And Robin, I believe, is presenting this to us. So if you'd like to proceed, Robin, the floor is yours.
Sure, thank you. Good morning, commissioners. I am Robin Tolan from the Cumberland Perry County's Mental Health Office, and I am the coordinator for the Human Services Block Grant Plan. It is a plan that includes 5 different categorical areas: mental health, intellectual developmental disabilities, substance use disorder, Human Service Development Fund, and Homeless Assistance Program. So in addition to myself, Sue, Jack, and Sandy will also say a few words about the plan and their portions of that. The plan is for mental health, IDD, and substance use disorders is also a joint plan with Perry County, and we did present the plan on Monday to the Perry County Commissioners for those portions. So for the mental health portion, we have had, as everyone has, a bit of a different with the pandemic and everything. And we've had a lot of adjustments being made with our service providers and the services that, how we were able to provide services within our communities. So we have had a lot of flexibility demonstrated in those areas, but successfully so, and for the most part. We've also, in the plan, has some information regarding our, a number of our initiatives, including our suicide prevention initiative. There's a chart in the plan that talks about the decrease in suicides that we've noted in both Cumberland and Perry counties in the last year, which is a good thing based on some of the initiatives that we have. So I am gonna, basically the plan is pretty lengthy. It's about 80 some pages. So I'm gonna just hit the highlights for the mental health portion with regard to our priorities. The plan also, you may be aware, is a template that the state establishes, has specific questions that we are to answer. So it isn't just a narrative document, but we have a lot of different categories that we have to address within the plan. And certainly if any of you have questions about any specifics that you may have reviewed in the plan, we can certainly answer those. With regard to the mental health priorities, there are, trying to find them here in my document, there are 7. The first priority that we have, and we've had this for a number of years, is to maintain our current services and supports. As most folks are aware, funding has been gradually decreasing in a number of areas, and we're certainly concerned with next year with continued funding for mental health services. What our folks in the community have expressed, as well as our consumers and our providers and family members, that they really value the level of service that are currently provided for mental health needs, and really hope that those services can maintain. And so that is a priority that we have listed as an area to continue focus on, that we would be able to continue those services and be able to maintain those levels of services in the community. The second priority was a goal last year of implementing the long-term structured residence, the LTSR, and we are, I'm happy to say, moving finally toward implementation of that. We're looking now at end of August, beginning of September implementation dates for the LTSR. There were some gaps there because of the pandemic and the building construction not being able to continue for a period of time. The LTSR is a program that will serve individuals with mental illness who are currently hospitalized at Danville State Hospital or at Torrance State Hospital or incarcerated, and some of those folks may have been determined to be incompetent to stand trial. So the LTSR is a locked facility, 24/7 staffed. We do have a lot of security initiatives already in place there to maintain safety for the community as well as the residents who will be there. And it's a 16-bed facility. I'm not sure if I mentioned that. So we are hopeful that that will be opening in September and be able to move folks out of the state hospitals, which will then decrease our occupancy there in the state hospitals and have people back in the community and able to have more contact with family and their natural supports. The third area is to increase awareness of available services in Perry County, and that has been an initiative for several years also, based on a study that was done by the Capital Region United Way and Partnership for Better Health that showed a significant need for mental health services in Perry County. What we've done is join with a lot of the local entities there and be able to increase awareness of the services that are available, and then look at what the needs might be once those services are being utilized more effectively. The fourth priority has been our suicide prevention initiative, PULSE, Preventing Unnecessary Loss Through Suicide Education. And that has been an ongoing initiative that we've had to be able to, again, provide awareness training, provide education. We've also had a number of folks trained in QPR, Question, Persuade, Refer, which is a suicide prevention initiative to help people get more comfortable with talking about suicide and then connecting folks with the services that they might need. We actually have also, as you all may know, one of our HR representatives is a trainer for QPR and has been training a number of the county staff through that initiative. Our fifth priority is for our school-based program to transition into becoming an ESAP, an Elementary Student Assistance Program. SAP, Student Assistance, has been in place for years in the school districts in the state, and it has primarily been a secondary initiative for middle and high school students, but the initiative also was supposed to include elementary. And so what we were doing is transitioning our elementary school-based program to be able to be an ESAP, a certified ESAP team, elementary student assistance program team. They will work with the school districts in identifying mental health needs of students and be able to then connect them with services. Very similar to what they are already doing as a CASP, as a Child and Adolescent Service System program team within the schools. They're located in all of the school districts and elementary schools in Cumberland and Perry counties. This will be very similar, although it will be under the ESAP model, the Student Assistance Program model. So that is the change there. And then the next priority is the continuation, again, of priorities that we've had previously in our counties regarding improving awareness of the trauma-informed needs, improving different departments' expertise and comfortability with providing trauma-informed care for a lot of our residents and our constituents. So there's a lot of information about the various ways that we are managing that and implementing those different things throughout the county. Actually, there's some juvenile probation initiatives, as well as some initiatives with emergency management services. And then our last priority has to do with updating our continuity of operations plans. Obviously, given the pandemic, it put a lot of those operation plans into effect, and we're noticing where there might have been gaps or needs, and that is a priority then through the next year, is to make sure those plans are updated and current based on the needs that we're having. So those are the mental health priorities in the plan. I'm not sure if anyone has questions about that, or if we want to go on to Sue for the intellectual and developmental disability piece.
Yeah, that's fine. Proceed, please.
All right, good morning. For the IDD section of the plan, once again, our IDD goals focus on service and supports in our community. We do our best not to send anybody out of community, but sometimes we do have to do that, but it is very few. We are always supporting our individuals to have choice and control over their life and their services that they want to have. Our focus on supporting folks is to be as independent as they possibly can be, as well as contributing members to our community. So we do this by promoting competitive employment, such as our Project Search program, which you all have been very supportive of, We promote independent living with support. We have a supported living program. We also are now supporting technology to help individuals in their apartments. Because of the staffing crisis that we have across the board in human services, we have been looking at how technology can help us to support our individuals, and we will have some pilot programs with that this coming year. We have both the administrative unit for IDD and this case management unit for IDD here in the office. I will tell you that they have been working remotely since the county closed, and they have been doing an excellent job of supporting our folks and constantly checking in to make sure that they have what they need, and if they are having any issues, if there is anything we can do to help them. Let me just talk a little bit more about Project Search because of your support for that program. We had to close Project Search in March when the county closed. So our third class was not able to finish. So what we have done with the third class is offer them the opportunity to do job searching now and begin looking for a job, or to come back in September when we are hoping to open up for the fourth class and complete their third rotation. There's only a few that would be doing that. We are also looking at our fourth class opening in September, and we do believe it will be a smaller class because of COVID and maybe not being able to get into all the internship sites. So we thank you for your continued support of Project Search, and as everything opens up, we hope that it takes off again too. Let me see. We have our independence program, Pathways Academy, which is where folks go and live for 12 to 18 months, learn independent living skills. There's an educational component to that program. And when they finish the program or graduate from that program, we then help them to find apartments in the community. And they're able to live in the community with some HAB supports of typically 10 hours or less a week. So we think that's pretty well, and that really emphasizes the success of the Pathways program. We do a lot of cross systems works with our mental health partners in the county and the school district. We have some unique services for our families that other counties do not have, such as the IDD task force, which is the parents of the folks that are registered with us, and they have been typically meeting on the first Wednesday of every month. They do a lot of advocacy work for us with the legislators, talking to them about funding and waivers and disproportionate amount of waivers that Cumberland County receives. And they don't quit. They just keep moving right along. We also have another service, which is a consumer family transition consultant, who has a master's degree in counseling, who I contract with to work directly with families who are having issues with any type of transition, whether it be transition from school to adult services, from living at home to living in a group home, or those elderly parents that just cannot take care of their individual anymore, and they have to let go and let that person go and live in a group home or an apartment, whatever the case may be. And she has been phenomenal in that role, and it has really been tremendous service for the families here. We have a nursing unit that provides us nurses, clinicians, and others with expertise in the area of intellectual disabilities, autism, and healthcare. And they are ever ready to help us and the providers do what they need to do to support our individuals and help them to be as safe and healthy as they can. Our providers think I told you this before, but I'll tell you again, have been phenomenal through COVID. We only had 30 individuals that were tested. Only 4 of them actually were positive. None of them were in the residential group homes that were positive. So they did what they had to do. They stepped up to the plate. The staff stepped up to the plate. They spent extra hours with the folks. They were innovative, thinking of things that they could do, and they have been terrific. Let me see, what else? And like I think some of the other human services, we're not real sure what's gonna come our way as far as the budget. We do know that we are on a 5-month flat funded budget for the time being. And in the fall, they will renegotiate the budget, and what that will look like then for the last 7 months of the year, nobody knows. We can only cross our fingers and hope. So thank you. And does anybody have any questions on the IDD section?
Thanks, Sue.
Okay, if not, then can we go to Jack for the substance abuse?
Go ahead, please.
Good morning, Commissioners. I think it will not come as a surprise to you to hear that our overall priority for the new fiscal year will be the same as it has been for the last few fiscal years, and that is to address and focus on the ongoing opioid health crisis. We had seen some significant success. The most important metric that we focus on are the number of overdose deaths in the county. And between 2017 and 2019, we saw significant decreases, a total of a 46% reduction in overdose deaths. We suffered 86 deaths in 2017. We're down to 52 in 2018, and a further reduction in 2019 for 46. And so we were encouraged by that progress. But in the past few months, of the first half of this year, we've seen that progress slip away from us. And in particular, as the COVID-19 pandemic took hold, and the social restrictions that were understandable and necessary to protect all of us, unfortunately put folks who are actively struggling with an opioid use disorder, or individuals who are in early stage recovery, and that recovery is still somewhat fragile, it put them in a very risky position. Those who work in the drug and alcohol field and who are familiar with the disease of addiction understand that social isolation is very difficult, and a very difficult situation for somebody who is dealing with a substance use disorder of any kind. And so we keep in close touch with Charlie Hall, our Cumberland County coroner, and the latest data that we have is through June 11th, and there have been 33 overdose deaths through June 11th in Cumberland County. This would put us on a pace to not quite equal, but come close to that same high watermark of 86 overdose deaths in 2017. And so we want to redouble our efforts and continue to focus. One of the things that I've mentioned before in our meetings, and I'll just quickly reiterate, a lesson that we've learned is that the opioid epidemic is complicated, multifaceted, and it requires the down to that we are reducing the increasing access to naloxone or Narcan, the opioid overdose reversal medication, increasing access to substance abuse treatment overall, but in particular to the 3 forms of medication-assisted treatment that have proven to be effective for somebody with an opioid use disorder. That is methadone, Suboxone, and naltrexone or Vivitrol. Continuing strong community education and prevention efforts, and continuing strong drug enforcement efforts. 4 of those 5 areas fall within our mission. The one, of course, that doesn't is drug enforcement. We do communicate and cooperate on an ongoing basis with our partners in drug enforcement, and we're very, very grateful for their continuing efforts. In particular, in the past year, we've especially focused on increasing access to substance abuse treatment and increasing access to naloxone. With 2 factors. One is the Pennsylvania's decision to opt into medical assistance expansion. That has allowed us to provide substance use disorder treatment to an increasing number of Cumberland County residents. In particular, with MA expansion, people who fall between 100% and 138% of the federal poverty level are now eligible for medical assistance. Those people used to rely on the capped or limited funds that our agency managed to pay for their treatment. That means that those funds are released and freed up for us to use on other county residents. In addition, for the past few years, we have enjoyed an influx of additional federal funding specifically to address the opioid epidemic. And that has allowed us to greatly increase treatment options. We have not had to place a moratorium on any level of care, and so that's been good. And we've also been able to expand access to the 3 forms of medication-assisted treatment. In particular, within the past year, we've seen a number of our providers integrate the forms of MAT into their overall treatment program, and we hope and expect to see that continue.